Well, it's time for another segment with Dr. Perry from Frontier Health. And this time around, we're talking about Mental Health Awareness Month and more specifically, how your workplace can impact your mental health. Dr. Perry, thank you so much for being here.
Absolutely.
Well, we know that the workplace is a place where you spend a lot of time throughout the week. How can that impact your mental health?
Well, what we have found is that there is a significant level of stress in the workforce. Actually, as a matter of fact, last year, 70% of employees reported that they were feeling overstressed at work and feeling symptoms of burnout. When you add that to a workplace environment, it's going to negatively affect that work performance in the community.
Well, what are some signs that your job is impacting your mental space?
When you're feeling like you're burnt out all the time, you don't want to go to work, you have this phobia about work, you have confused thinking when you're at work, you find yourself getting agitated, irritated very easily, you found yourself wanting to find reasons to not go to work, so absenteeism goes up, you find yourself looking at the future very dimly and bleakly, thoughts of hopelessness, delusional thoughts, and unexplained rage and anger. If you're starting to experience that or depressive symptoms on a constant and regular basis, it could be the effect of something in the work environment or something in your personal life that's filtering into the work environment.
Now, what should you do once you start realizing that this is happening to you?
First of all, recognizing it and know that there are things that can be done. You don't have to turn to unhealthy mechanisms to cope with that stress, like drugs or alcohol or self-harming behaviors. Talk to your employer. Many employee programs now have mental health services built into their health care and wellness plans. So talk to your employer, get some tips, and reach out to a professional to get some coaching and some advice on how to deal with workplace stress. There's good treatment available for that.
And what are some ways that you can navigate that conversation with your leadership and maybe even your coworkers too?
Well, just having that conversation about, I'm feeling tired all the time. I'm really not invested in my work as much as I once was. I feel very disconnected to work, disconnected to my employees. I just don't feel like I'm getting much benefit from work, and it's affecting my ability to do this job. That's kind of the beginning conversations. Employers want good employees, and when you're willing to come out and say, hey, I'm having a problem, but I think it's something that can be addressed, most employers are very willing to help you find resources to address that.
And when is it time to step away?
Well, when you reach the point where you can no longer do that job effectively, when you feel like this is no longer going to be a benefit to the company or to me, or I am just at a point where I feel like, I'm exhausted all the time, I have to do something to take care of my health. Otherwise, I'm going to end up in a hospital or some other health care facility. So it's time for me to make some definite life-changing decisions.
All right. Well, Dr. Perry, as always, great advice. Thanks so much for stopping by.
Always.
Yes. Well, plenty more coming up.